Mr. McDonald. Hi, my name's Dr. Cindy Braithwaite. This is Dr. Fiona Gibson.
Hello.
How are you feeling?
Why have I got two doctors? What's going on?
Oh, it's just routine observation. So how are you feeling?
Awful.
Right. Can you explain the pain that you're feeling?
I've got pain in my stomach and I've got a headache.
Okay. With that pain, if you were able to rate it out of 10, with 10 being extreme pain, 0 no pain, how would you rate your abdomen?
4.
Okay. And your head?
Maybe a 2, 3.
Right. Okay. And we gave you some medication for your vomiting.
Mm-hmm.
How's that working?
Good. I haven't vomited for about an hour.
Okay. All right. So, as you know, we did some tests.
Yeah.
The results have come back
Okay.
in one of these folders. Pretty much, the results show that we really don't know what's happening. It looks like we have to do some surgery to find out.
Some surgery?
Yeah. With the abdomen...
Why do you have to do surgery?
Well, as I was just about to say, with the abdomen, it's quite a complex area, so it's often inconclusive.
What happened with the tests?
Well, the tests are inconclusive.
They're well, can you do better tests?
Look, at this stage, we've done all the tests we can, so this is the
So you're
final
just going to
result.
cut me open? Like, I thought surgery was meant to
It's
fix
very
people,
safe.
all right? Safe? You're cutting me open, all right? How's that safe?
Look, we're here to look after you at the moment, okay?
What sort of hospital is this? I mean, it's ridiculous. You can't find your tests. You've got to cut me open. You've got 2 doctors. Why don't you just tell me what's going on?
I know what the tests are. It doesn't matter if I can't find them.
It doesn't
okay?
matter if you can't find them.
No, it doesn't. At
Is
this
that really
stage,
a response?
At this stage, I'm trying to tell you that we need to do more tests. Can you understand that?
Okay, we might finish up here. Someone will be with you shortly, Mr. McDonald. Thank you, Dr. Braithwaite. Okay, I need to talk to you about what just happened in there, all right? Now, what I saw was a professional doctor acting very unprofessionally, all right?
What do you mean?
You were out of control, you looked flustered and frazzled, and you were not on top of your feelings. You let the patient get to you. You didn't have any consideration of what he is going through.
I tried.
Well, you didn't try hard enough, I'm sorry. Now, I know you've probably had a big night, you've been on all night, you're tired. I'm sorry, that doesn't factor into it. You need to go right above that, rise above it, and act like a professional. Act like a doctor. You are a doctor. I want to see you be a doctor. All right? Now get back in there to your patient and take care of him the way that you should have been doing this morning.
How are you feeling?
A little bit worse.
The pain?
Yeah, it's starting to flare up in my stomach a bit.
Vomiting?
I'm starting to feel a little bit nauseous again, so if I could get something for that, that'd be
Medication? Yep.
great.
Okay, you've been booked in for surgery for this afternoon.
Okay. If I could get some more.
So, Cindy, I thought it was a good idea if we grabbed an opportunity now, while it's still fresh in our minds, just to talk about what was happening on the ward with Mr. McDonald just now. So,
Okay.
what do you think was going on?
I guess for me personally, I found him quite aggressive. I found he was nagging at me constantly. I was trying to explain to him his test results. I was quite tired. I was doing my best to get everything out, and he was going at me, and I lost it. Yeah.
Well, I'd agree with that assessment of the situation. I'm interested to hear a little more about what was happening for you. You were tired?
Yeah. Oh, look. I'm new to being a doctor, so I'm finding it all quite stressful. I was on call last night. I've got a personal life as well.
Yes.
It's hard to fit everything in.
It is hard to fit everything in, and I completely understand and empathise with you because I have been in that same position. I was a junior doctor once upon a time, many moons ago now. But so I understand that, and it is difficult, and there is a lot going on when you're starting out.
Well, that's nice to hear.
Yes, it's you're doing fine in that regard. That's not unusual what you're experiencing.
Okay.
I guess what's important though is that we also, amongst that, we have to understand what's going on for the patient, and we have to put ourselves in his shoes or her shoes and understand why perhaps they are behaving or presenting in the way that they are. So. Tell me a little about what you think might have been going on for Mr. McDonald.
I should have really seen that he was in quite a lot of pain. He was tired. He'd been vomiting, so that's never nice. And also, I guess, the worry about what was going to happen. You know, his family history.
Yes.
I didn't even think of that at the time. I was so rushed. But yeah, I should have. You're right. I should have thought about that.
So it's difficult as clinicians to put ourselves in that mind space sometimes. But I guess part of being a doctor is our ability, and really it's necessary for us to develop our empathy and to understand what's going on for the patient at all times. And to maybe take a moment before we engage with them to just think about that.
Okay.
Because for the patient, he's not deliberately trying to wind you up or needle you. He's just trying to get information.
Yeah.
And as you've articulated, he's worried. I mean, he has a family history of stomach cancer. I mean, you know, goodness, he must be, all sorts of things must be going through his mind.
Yeah, you're right.
And he's not sure what the tests mean. There's a whole range of things. Plus, he's in pain. He is experiencing nausea. He's been vomiting. It's multifaceted what's going on for him. So, with all that in mind, what do you think you might be able to do differently in your next interaction with Mr. McDonald?
Well, I suppose put myself in his shoes, as you say. You know, empathise more. Think about what that must feel like to be feeling that unwell and hearing that he has to have surgery and not being explained, you know, what the surgery involves or, you know, what the outcomes could be and that kind of thing. So, yeah, I would, if I was to do it differently, I suppose I'd definitely think about those things. And yeah, be a better listener.
A better listener. Okay.
Yeah.
This is about sort of what you can do from now on, really. So let's think about it in a positive light. How you can improve your performance. How I can help equip you to be the best doctor. And by the way, you're fine.
Thank you.
You are doing well. This is
nice to hear.
Everyone faces these moments. I guess what's important too is to know that there will be many patients like that in your career, and you will become more resilient to that. People present with all sorts of problems and in all sorts of states, and I guess we have to find within ourselves a kind of place where we don't allow ourselves to take it personally.
Yeah.
That we just remain professional at all times. So soon you'll get an opportunity, once Mr. McDonald's surgery is scheduled, to re-engage or engage with him and put into practice some of the things that we've discussed now. So I think that's great.
All right, thank you. Hi, Mr. McDonald. How are you feeling?
A little bit worse.
Oh no. How so, in terms of pain or?
Yeah. About,
in your abdomen?
yeah.
Okay. Are you able to scale that from 0 to 10?
Maybe 5, 6.
Okay. And what about your headache?
It's about the same.
Okay. What about the vomiting? Has that stopped?
A little bit more nauseous.
Okay. I'm looking into something for that.
Okay, thank you.
No, I'm sorry about before. I know surgery can be confronting. and I know about your family history. So, we are going to do everything we can to get to the bottom of it. Has anyone from the surgical team been in to see you? No? Okay. Well, people will come in soon to talk about, the logistics of it all, run through any questions that you may have. If you've got anything for me that you need to ask, please feel free. If you need some more water or anything else. No? All right. Well, rest up, and I'll see you soon.
Okay, thank you, Doctor.